Dear students, in this lesson we will be discussing the remaining SLOs of reproduction, that's about lactation, in vitro fertilization and sexually transmitted diseases. Let's move. Student learning outcomes. Define lactation and colostrum. Explain in vitro fertilization. Describe causes, symptoms and preventions of sexually transmitted diseases, that is gonorrhea, syphilis, genital herpes, acquired immune deficiency syndrome, commonly known as AIDS, and then differentiate between spontaneous and induced abortion. First, lactation. Lactation describes the secretion of milk from the mammary glands and the period of time that a mother lactates to feed her young. In humans, the process of feeding milk is called breastfeeding or nursing. So, this is just about definition, but you need to know that prolactin is the hormone which is responsible for milk production towards the end of the pregnancy from the mammary glands, and oxytocin is the hormone that is responsible for milk ejection stimulated by suckling action of fetus or the infant, not fetus, sorry. Then colostrum. Colostrum is the first milk that mammals, including human beings, they produce. It's an important source of nutrients that promote growth and fights diseases in infants. It is the first vaccine, which is also known as natural passive immunity for an infant. So, for some women, colostrum is thick yellowish fluid, and for others, it is thin watery fluid. Colostrum is not actually milk, rather, it is a fluid. So its color can vary from individual to individual, so it's very important to feed the young one with colostrum because it is providing important nutrients, important antibodies, important vitamins and other nutrients to the newly born baby. Moving on, next SLO is about in vitro fertilization. In vitro means in vitro is something outside the body. So in vitro fertilization, also known as IVF, is a process of fertilization where an egg is combined with sperm outside the female body. So fertilization outside the female body is actually in vitro. Fertilization inside the female body is in vivo. So it's a complex series of procedure used to help infertility or prevent genetic problems and assist with the conception of a child. During in vivo fertilization, mature eggs are collected, which is known as egg retrieval, from the ovaries, and they are fertilized by a sperm in the lab. So the resulting baby of in vitro fertilization, they are also known as test tube babies because this whole process is done under laboratory conditions. So what is the benefit of in vitro fertilization? Parents who are unable to enjoy the normal process of fertilization and birth of their offsprings due to some physiological or physical abnormalities in any of the two parents, they are being benefited with this method. It involves retrieving eggs from a women's ovaries. The ovaries are stimulated by hormonal therapy to release ovum, and then the egg is collected and they are fertilized by sperm in the laboratory. This fertilized egg then undergoes cleavage and form an embryo. The embryo can then be frozen for storage, or it can be transformed to the women's uterus soon. So it can be frozen for many years as well. Recently there was a news that embryo was frozen for 27 years, and recently it was implanted into the uterus and a baby girl was born. So this is an amazing process. Here are the methods of in vitro fertilization. Starting from here, that ovarian stimulation hormone therapy is given to stimulate the ovaries to release an egg. Then that egg is through a special needle, it is extracted from the ovaries, and that the eggs are collected and the sperms are also collected from the male, and they are fertilized in a petri dish under laboratory conditions. Then the egg is left for it undergoes cleavage, and at a certain cell stage it can be injected back into the uterus of the host mother for further development of the embryo, and the pregnancy can be sustained naturally, or it can be initially given hormonal therapy, and then it can continue by the natural process. Moving on, next SLO is sexually transmitted diseases, also known as STDs. Sexually transmitted diseases or sexually transmitted infections are infections that are passed from one person to another through sexual contact. So following are common sexually transmitted diseases. The first one is gonorrhea. It's causative agent, or it is caused by a gram-positive bacterium known as Neisseria gonorrhea, mainly affecting mucous membranes of urinogenital tract in both males and females. Its symptoms are early symptoms include pain when urinating or discharge. Newborns may get serious eye infections if they pass through the infected birth canal. Preventions are, of course, for all the sexually transmitted diseases, the only prevention is to abstain the sex, or abstaining from the sex means not having sex if the person is infected, is the surest way to prevent gonorrhea. Having a single sex partner and using other safe ways can prevent gonorrhea. Next is Cephalus. It is again caused by a bacteria spirochete, that is Treponema pallidum. It damages the reproductive organs, eyes, bones, joints, central nervous system, heart, and any part of the skin. In this picture you can see these are what are the symptoms. The first sign of Cephalus is a small painless sore. The sore is usually that is not noticeable and it is painless. It can appear on the sexual organs, on the rectum, on the inside the mouth, and the rash usually won't itch, and it is sometimes so faint that you won't be noticing it. Other symptoms you have can include fever, swollen lymph glands, sore throat, patchy hair loss, headache, weight loss, muscle ache, and fatigue, which is usually the tiredness. So again, the prevention for this Cephalus is again the only certain way to avoid Cephalus is to not have sex, that is abstain from sex when infected, and practice safe sex. Next is genital herpes. It is caused by herpes simplex type 2 virus. It is viral disease, and the symptoms are it produces genital soreness and ulcers in the infected area. Here you can see this is the ulcer, and then soreness in any part of the body. In infected female, a virus can be transmitted to infant during birth, causing damage to the eyes, central nervous system of the infant. Preventions: safe sex practices and monogamous, that is having one partner. Then last but not least, this is the most dangerous sexually transmitted disease, that is acquired immune deficiency syndrome, commonly known as AIDS. AIDS is a chronic, potentially life-threatening condition caused by human immunodeficiency virus HIV. HIV can transmit when body fluids containing the virus come into contact with a permeable barrier in the body. Symptoms are rapid weight loss, recurring fever or profuse night sweats, extreme and unexplained tiredness, prolonged swelling of lymph glands in the armpits, groin, and the neck region, diarrhea that can last for more than a week, soreness of the mouth, anus, and the genitals, and pneumonia. How to prevent AIDS? Using safe sex methods, um, avoid usage of needles and drugs, intake of nutritious food helps boost immunity, avoid breastfeeding by mothers who are infected, avoid intercourse with multiple partners or sex workers and other addicted drug users. This is something related to the society as well. It depends on the type of society where a person is living. For example, if there is a culture of having multiple sex partners, usually this AIDS is common in African countries. So it depends on the social context as well. So during pregnancy, infected mothers can reduce a risk of transmitting this virus to the baby by keeping herself healthy by using safe methods. So this was all about sexually transmitted diseases. Last SLO of today's lesson is about abortion. Abortion is usually, this term is used for termination of the pregnancy intentionally, but in your SLO they have named the types of abortion as spontaneous abortion and induced abortion. So let's discuss first what is spontaneous abortion. Spontaneous abortion refers to loss of pregnancy at less than 20 weeks gestation in the absence of elective medical or surgical measures. So without elective surgical or other medicinal measures, if the pregnancy is lost due to any other reasons, so it is known as spontaneous abortion. But the most appropriate word for spontaneous abortion is miscarriage. Miscarriage is synonymous and often is used with the patient, because the word abortion is usually, I already mentioned, it is used for something which is done intentionally, but most appropriate word for spontaneous abortion is miscarriage. So what are the causes of miscarriage? It can be due to infection, it can be due to exposure to environmental and workplace hazards such as high levels of radiations or toxic agents. I hope this remind you of the incident of Hiroshima and Nagasaki incident. At that time there was a nuclear war, and due to that nuclear radiations, different pregnant women, they lost their pregnancy at that time, and many of them gave birth to abnormal children. So this environmental exposure, environmental hazards can actually they are one of the most common cause of miscarriage. Then the hormonal irregularities, of course. If there is hormonal imbalance, like if there is less secretion of progesterone and estrogen during the pregnancy, of course the pregnancy is going to be terminated. Then improper implantation of fertilizer in the uterine wall, in the uterine lining. So I already discussed implantation. Implantation is the attachment of the embryo with the uterine wall. So if the implantation is not in a proper position, for example, if it is near the cervix, it is if the implantation has taken place at the end of the uterus near the cervix, so the placenta cannot form properly, so it can lead to miscarriage. Then it also depends on the maternal age. So older females, they are at the risk of miscarriage. Then uterine abnormalities and incompetent cervix. So these are the causes of spontaneous abortion. And next is induced abortion. This is the actual abortion, an abortion that is brought about intentionally, also called an artificial or therapeutic abortion. 80% of these spontaneous abortion, this must be induced abortion, happens in the first trimester. So causes are genetic abnormality or defect, unwanted pregnancy or multiple pregnancy, if the pregnancy is mistaken or there could be different reasons. So the pregnancy can be terminated, that is abortion. And abnormal placental insertion, if the placenta is not inserted in a proper place, that can also that that can result in abortion, that can compel the parents to abort. So these were the causes of abortions. This was all about all. We are done with the chapter reproduction. These are the last SLOs. Hope it was clear to all of you. Thank you so much for listening.